Welcome to Houston.
Yes, in 6 days, a team that has not been to a World Cup in 52 years walks onto the field in Houston, the Democratic Republic of Congo. The whole world is about to land on U.S. soil. And I want to tell you how we have decided to greet them. We took a referee, a man named Omar Artan, the best referee on the continent of Africa, and we held him at the airport for 11 hours. Then we put him in a cell. Then we put him right back on a plane home. Now, he had the right visa. He had the dream of his life, and we sent him back anyway. So we have agents for that, right? But the country the team is coming from is fighting a virus with no vaccine and no cure, and a scientist whose entire job it was to stop it before it ever reached the stadium. We fired them. So I'm Dr. Ida Brown in New York.
And I'm Dr. Sonia Sloan in Houston, where this whole thing is now about to go down in my backyard.
And we are Aya,
Black and brown women disruptors in healthcare and beyond, and apparently America first. I mean, that includes the airport, right, Dr. Brown?
So we're not here as pundits today. We are here as physicians because this is not a sports story and it's actually not even an immigration story, right? This is a public health story. And we can show you exactly how the pieces connect.
Yeah, so let's start with what actually is happening because the fear traveling is faster than the facts right now. So we need to go through what those facts exactly are. That there's an Ebola outbreak in the Dominican Republic of Congo and Uganda. And it's called the Bunji Boho strain. And so this is the 17th Ebola outbreak in the Congo it's faced in years. And so here's what makes this one more frightening to us as physicians and doctors. Most of the Ebola strains now have vaccines. However, the Bundy Bojo does not have a licensed vaccine and no approved treatment plan right now. So what saves lives in early support care right now and really catching it fast. So monitoring and testing.
And so, Dr. Sloan, catching it fast is the whole ball game, right? So in medicine, we say the same thing in the trauma bay that public health says in terms of an outbreak. Timing is everything. Timing is everything. So you find it early, you isolate it, you trace the contents, and then you contain it where it starts. So again, you find it early, you isolate it, you trace the contacts, and you contain it where it starts. But Dr. Sloan,
that's not what's happening right now. So let me say the thing I most need everybody in Houston to hear, because that's my city, right? And it's about to fill up with the entire world. And so we're not going to catch Ebola at NRG Stadium or any of the downtown places that people are going to be populating. You're not going to catch it sitting next to a Congolese family cheering for the leopards, right? Ebola does not spread like a cold, like COVID. It spreads through direct contact of bodily fluids that someone who is already sick. So our own CDC rates the risk of spread in the United States very low.
and here's what is actually true and what I need every Houstonian to sit with, and that's from a New Yorker, New York City to be exact. You know, Houston is only one of the three airports in the entire country that, with Dulles and Atlanta, where travelers are coming from the outbreak zone and they're funneled in and screened. So again, Houston, Dulles, and Atlanta are the three airports. And a CDC officer meets them and asks where they have been, asks about their symptoms, and then hands them a questionnaire.
Yeah, and I've looked at this questionnaire. It's like 2 pages front and back, and so it's not like just basic questions. And everyone on answering these questions have to go through this person that's highly trained, that's going to be reading it and trying to connect the dots, right? So one deciding that needs to look or take a second look before that person can actually walk through the doors into the United States. So connect this dot for me, Dr. Brown. When you are fired, more than a quarter of the agency that's supposed to be screening these people, who's left at the job that's doing this job? There's like three people. What? I'm not sure. I'm sure they're exhausted, right? And they're stretched thin, and there's has to be a breaking point at some time.
Right. Exactly. So we cut the staff that's supposed to be screening this. So those that are left are going to be struggling, right? So we're not telling you to be afraid, right, of the virus. We're not telling you to be afraid of Ebola. We are physicians. We are telling you the truth. A forum does not catch an outbreak. A trained, rested, fully staffed expert does. And we are pulling that expert out of the chair right as the whole world lands in Houston. Let's roll the next clip.
U.S. aid operations like these used to help trace and treat past Ebola epidemics in Africa. Now, health workers say they've been left blind after the Trump administration pulled U.S. funding.
I think the U.S. funding cuts certainly contributed to the late understanding of the current situation and is part of the reason why we're so behind in responding now.
CBS News medical correspondent Dr. Celine Gounder worked in West Africa during the Ebola crisis a dozen years ago. She says the funding cuts would have been felt immediately.
Once you don't have money, once the money runs out, you can't be ordering supplies from various different sources. You can't be paying salaries.
Meanwhile, aid groups in the Congo are working with local communities, opening treatment centers like this new 60-bed facility built by the World Health Organization. The first suspected Ebola case was 40 days ago.
Why did it take so long?
This Ebola type is a rare one. The test kit people used was optimized for the Zaire type and not for the Bundibijo type.
Right. So, we're playing catch up, right? So let's just talk about what we tore down, because there is, this is where it stops being a foreign story, right? This is thinking of disease surveillance as a detective squad. And the people whose job it is to spot an outbreak early anywhere in the world and stop it before it gets on a plane, right? We had the best squad on earth. And in 18 months, we dismissed it.
Yeah, so let's break down the numbers, Dr. Brown. I mean, the actual numbers that are going around now.
So since January of last year, the CDC has lost more than a quarter of its workforce. The union puts it at roughly 4,300 people, so about a third of the agency. And right now, walking to an emergency, the CDC has no director, no principal deputy, no chief of staff, no chief medical officer. So every one of those chairs is empty. And these cuts hit the exact teams that contain infectious disease: measles, Ebola.
And just that, it's here at home. The part that reached Congo directly was USAID, and USAID was the glue. And it closed on July 1st last year. Around 80% of its global health grants were terminated. Its staff went over from 10,000 people to a few less than 300. So former officials say almost everyone who worked the last Ebola outbreak in Uganda was fired. And one of them put it plainly: the epidemiologists and the virologists who train for exactly this moment are no longer there.
So this is the first major outbreak of its kind since we dismantled the system that backed every Congo Ebola response since 2014. There are no detectives on the case.
And Dr. Brown, people need to remember what 2020 looked like. It may have been 6 years ago, but listen, that was chaos. It was mixed messaging. There was no freaking plan. It cost millions of lives. And we both watched how many lives it cost, even one of your own family members.
Exactly. And it did. But here is what most people forget. So in 2020, there were still guardrails, right? The career scientists were still in their chairs, the agency leadership, the people who spent 30 years building that system, the generation that Dr. Anthony Fauci came from, they were still there. So even in the middle of the chaos, they were able to execute enough public health protection to keep it from being even worse. But Dr. Sloan.
Yeah, and now starting early 2025, those guardrails were pulled out of the roots, right? And I mean, just X'd out. So the career scientists, the agency leadership were fired, pushed out, replaced by who? Loyalists to Trump. The director's chair empty now, and people who held the line for us, U.S. citizens, in the worst are now gone.
So again, elections have consequences. And this is what they look like in a hospital. And this is what they look like in an outbreak.
Yeah, and nobody's going to tell you this, but we will. Because it's about saving money, right? So let's follow the money.
So they found $2 billion in shutting USAID down, right? They cut $647 million from global health security before this outbreak ever started. And then, only after people were already dying, they announced $23 million for the response. $23 million afterwards.
They found the money, all right. They just found it late, and they found it for the wrong things, no less. They had 11 hours on holding a cell for a referee. Come on, people. They had border agents and enforcement lanes fully staffed at the airport, where the public health screeners are running on fumes and not getting paid. But outbreak responders on the ground in Congo, fired. The emergency fund for the World Health Organization that used to lead these efforts is nearly empty, and down to about $5 million because we walked away from the table a year ago.
So this is not a budget problem. This is a values problem. You can fund the fear or you can fund the science. They chose the fear. So no, there are no detectives on the case. Let's run the next clip.
Other top stories across the state tonight. Today, Houston's Bush Airport started screening passengers for Ebola. The airport is one of 3 in the country designated as entry points for people who travel to African countries affected by the Ebola outbreak. All flights from those countries will be directed to Houston, Atlanta, or Washington's airport.
So let us get back to that gateway. Your home, Dr. Sloan, Houston, Texas.
H-Town.
One of the 3 doors in this whole country for travelers from the outbreak zone. And here's what the same airport had no trouble staffing.
Yeah, they turned away the best referee in Africa, you guys. A man named Omar Artan, 11 hours of questioning. I can't imagine what was asked for 11 hours, right? They put him in a holding cell like he was a criminal. And then they turned around and flew him back home. He had the right visa, you guys. He had the dream of his life to be here in the United States during this World Cup, right? But Iraq strikers held 7 hours in Chicago, right? And their photographer was also sent home. Players have screened by what? Dogs and metal detectors and wands, like they're suspects, not people here to be part of the games. The immigration enforcement side of the door is fully staffed, unfortunately, and it's very aggressive and it's funded. And the public health side, that's the very same door, right? But it's a skeleton crew reading questionnaires, right? And they tell you exactly what our government really has decided was the threat. And it's not a virus. Unfortunately, it's our visitors. And here's the lineage we cannot skip. In 1974, the same Congolese team, then known as Zaire, was the first team from the sub-Saharan Africa on this stage in America. And a whole generation of pride now has been tainted, Dr. Brown.
52 years later, they come back to a World Cup, and the country hosting them built a wall of agents at the front door and gutted the doctors at the side door. So history keeps teaching us who gets treated as expendable: Black, brown, African, immigrant, the body. Never the system. There are no detectives on this case because we decided the case was the people, not the pathogen, not the disease.
So here's what you can do. There's about 3 things. So Dr. Brown, start with 1.
Number 1, protect your house. This is not about Ebola. You are not catching that at a match. You're not catching that at a game. But you know what is? Measles. Measles is surging in this country. Flu and whooping cough are circulating, and summer brings big crowds. So get yourself, your kids, and all those that you know and love current on routine vaccines now, ahora, today.
Now, yeah. And then number 2, make some noise where the money is decided. Call your representatives, use the number, and remember there's 647 million cut from global health security. So tell them, your representatives, to build the disease detectives, or the workforce, before the next outbreak actually hits here, not after.
And number 3, and this is really important, everyone, be the calm one in your circle. So when someone in your group chat says the fans are bringing disease, you correct it immediately. You cannot catch Ebola from the seat next to you. The empty lab is the danger, not the family waving the flag. So replace the fear with some facts every single time. You know, a virus does not need a passport. It does not care what country you are from, what team you love, or whether the agent at the airport lets you through. It asks one question. Is anyone still watching?
And right now, in the places where it matters the most, the answer, unfortunately, is no. There are no detectives on the case in the United States. But we want to make sure that you guys stay informed, stay vigilant, and stay loud, because we're AYA, contributors to MeidasTouch, and we are proud members of the Meidas Mighty. So please subscribe, like, share, and follow for more updates, and keep the truth loud. Have a great week.
Thanks, everyone. Let's go, Knicks!
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.